Welcome back from that break. We are looking at the role of oral health in general health. And before the break, we've looked at we've looked at more onto oral health. Now, doctor, we looked at things that people should, the dietary things that people should maybe do away with, or how they can support their oral health when they use them. But what about the lifestyle behaviors that we can forego in order to maintain our oral health, but also our general health at large?
Lifestyle is a big issue. When you look at lifestyle, here you are talking about things like alcohol, things like tobacco. Let me say substance use and abuse. Indulging in, when you talk about lifestyle, you can still talk about health snacking or poor snacking. Why? When you snack poorly, chances are you have an obese someone or someone who is overweight, because whatever they eat, maybe they are unhealthy, and they end up having a lot of unnecessary foods which increase the body weight, and then you load your heart. Many things happen because of the unhealthy snacking. Then two, when you look at oral health and then you look at substance use, you will find that with tobacco use and overuse, chances are people begin developing oral cancer or the cancer of the mouth in different parts of the mouth, which sometimes will affect other parts of the body dependent on the time when it has been found out. The other thing is, of course, alcohol use. When you combine alcohol and tobacco, chances are high that you will get a cancer. And alcohol and tobacco, chances are high that you will have gum disease. Of course, it boils up at the end of the day. If you responsibly use these substances and you maintain your mouth clean, you may not have issues. But if irresponsibly use the substances and you don't have time for your mouth, chances are you'll have issues. For starters, you will find someone who is having bad breath because of certain things that they use. You will find someone, because of lifestyle, they are having plenty of cavities. And sometimes because of lifestyle, let's look at it this way. Some people get diseases by chance, while other people get diseases because of the life that they've been living, which says a lot. And when you look at the mouth, especially, and if you are the type of person who doesn't go and have checkups, and maybe since we are talking about lifestyle, some of these things might be recognized much, much later. We've seen patients who are coming in. They tell you from age 15, I was chewing tobacco. Or from age 15, I used to smoke a pipe, but I have a sore in the mouth. It has failed to heal. They will tell the dentist, my tooth is hurting, and the dentist might find a sore in the mouth and to ask, and then the patient tells you, it has been for the last 3 months or 6 months. I've tried all sorts of medicines, it has failed. But this person is forgetting the life they've been living Or look at someone who chews mairungi. They will come with the mouth black. However,
they say about kolaluba.
Yes, yes. However, they may have a wound in the mouth as a result where that mairungi was lying. And because of the chemical that was coming out of that mairungi, that wound might be cancerous. And the earlier, if they had been to see the dentist earlier, maybe the dentist would have advised, and then they would have been in a better positions. However, because of the bad culture of seeking care when we have pain, we acknowledge that when it's too late.
Doctor, we see a lot of cases of throat cancer these days. Is it also coming from this background of poor oral health?
Throat cancer, the causes might be different. However, they might be attributed to the lifestyle.
Okay.
The type of food you eat, the temperature of food you eat, and the amount of alcohol and type of alcohol one takes. Whereas there are other factors, but these are contributory factors. We can't deny it.
Okay.
You may not point a finger at a single causative agent, but there is a factor of time, there is a factor of the substance, and there is a factor of the person. So all combined, they will bring up the disease.
Okay.
Yes.
There is something you talked about. You are telling parents that if the moment you see a tooth in your child's mouth, take them to the dentist. Is there any linkage between the challenges, the childhood challenge, oral challenges, and adulthood, that if maybe they got oral issues when they were still young, this can affect their adulthood oral health?
There are many factors. One, the value attached to the oral structures or the structures in the mouth, in particular the teeth, will be different for someone who started seeing a dentist when they were young and someone who never saw a dentist when they were young. There are parents who will go to see the dentist and they say, after all, those are baby teeth, they are going to be replaced. Take them out. Not understanding that the timing of removing the child's tooth matters in having a perfect smile. If we prematurely, much as you might think they are diseased, don't wait until they are diseased. The moment they get diseased, it is like a finger on your arm. For mothers who peel, when you cut a finger, you do not take it to the doctor to cut it off. Or if you are barefooted and you knock your toe, you do not go to the doctor and have it off. What takes you to the doctor is to have treatment for that injured toe or injured finger. The same thing with the tooth. When we were created, God gave us every structure on our body for a purpose. If the tooth is diseased, have it taken care of. And the more the child goes to see the dentist, the more the value, the greater the value they will attach to their teeth. In other words, we are training values into this person. We are nurturing him to value every part of his body that he has, so that in the future, the Bible says, train your child
in the way
of the Lord when he's still young. So when he grows old,
he will not depart.
The same thing. If we train this child in valuing what they value, when they grow old, they will not run away from the right values. They will maintain those values that they've been nurtured in.
Okay. We have parents that surprisingly, even in the urban centers and cities, people still believe in false teeth. And we have very many parents who have taken their children to remove the false teeth. I wanted to translate it directly the way it is. Kukota binyo. But, doctor, does this have any effect, especially on someone's adulthood oral health?
I will tell you. The Baganda call it ebinyo. The Westerners call it ebino. The Northerners call it gidog. And some people call them plastic teeth. However, it is a myth, if that is what you are talking about.
Yeah.
They don't exist. What those people do, they are removing the teeth, which would have been the teeth. And in most cases, you will find those people who have had what you've called okukute binyo. They don't have adult teeth. Their mouths are empty because the tooth buds or the teeth that would have come in were gouged out and they remained toothless. It tantamounts to mutilation, what I would call oral mutilation. So it is something that we should fight tooth and nail to see that it no longer exists within our communities. Otherwise, we are torturing those children. It shouldn't happen. In the era where we are, it should be even criminal. Because if it was 50 years ago, the level of literacy would have been low.
Yeah.
But when you look at today, we have a high level of literacy. So, it is something that we should desist from.
Okay.
Yeah.
Then we realize that now the biggest problem is about awareness. And for example, when mothers go for antenatal, I think it is on rare occasions where they are told about, taken through childhood, maybe it might be postnatal care, but they're never told about the childhood oral health and all that. But you also realize that, for example, when you go to a general ward, you will not find a dentist to tell you much of these things. Worst, especially in public facilities, a dentist comes once a week, and so they're in a ward from about 8 to 1, and they have gone. So you realize there is no awareness at all. Someone only seeks guidance when they have a problem already. But what can be done to integrate this awareness into the primary care, primary health care?
That is why we are here as Mengo, to see what role can we play in educating the masses. We are partnering with Family TV to be able to educate our people the role of oral health to the general health. Then too, when you come to that, we advocate because all facilities where you have hospitals, they've employed dentists. We advocate for dentists being included in primary health care because there are many issues that could be mitigated much earlier before they would come to the hospitals to reduce on the amount of time that is used among everyone. If we can educate people, it becomes easier. And one avenue is when we have space like this one, we come in and we talk. Whoever listens takes on the message to the other one. As we reach one, we'll get where we desire to be.
Okay, that is interesting. But also, you realize that we think, for example, if someone came to meet a dentist, it's a little more expensive. Are there interventions to see that services are subsidized and made, for example, through health camps or things like that, to see that at least services are made a little friendly to the audience?
Every quarter or every year we have more than 6 community outreaches as Mengo and Uganda Christian University, we go out. It is part of our corporate social responsibility to teach the masses the good about oral health. And when we go out, we do emergency care, we do teach the people, and we do invite people to come, we take care of them. We don't wait for them to come to see us. Many times we go out so that we can give back to society what they've given us.
Okay. When I come to a dental clinic, because for us, we've actually even named dentists abakozi b'amannyo. So when I come to, that is what I expect. But is it a right thing? Is it a good thing? Because I believe it gives relief for some time. But is it something that is good for someone's oral health?
If that was about 30, 40 years ago, that used to be the trend. Today, we have plenty of dental surgeons out there. And dental surgeons are no longer what you are calling bakuzi. Bamanyo. But like any other doctor, they treat, they prevent, they teach. And the essence why they get the training they get is because they are supposed to treat, but not to mutilate. It is only and only when the tooth is irreparable that the dentist will accept to say, let me take out this tooth. However, because we are professionals and we do our work ethically, when a patient comes and says, take out the tooth, when you see, this is not what I want to do, you pass on the patient and you say, you know what, because of X, Y, Z, I cannot take out your tooth. However, this is the advice I give you. Go and think about it. Whatever happens elsewhere,
I'm not part.
However, as Mengo and as Uganda Christian University, we don't just remove people's teeth because we have to remove them, but we do treat and we long for prevention.
Okay. So we talked about some of the foods that people can restrain themselves from eating. But are there foods that are good for our oral health that you can encourage people to feed on?
Of course, the foods that are good for oral health, you need to have a balanced diet. And what do I mean? You can have some carbohydrates, you have fruits, you have vegetables, because each of those foods has different values that are of value to the body. You have those foods which have micronutrients, the small elements that are important. And you have those foods which provide energy. In other words, you need to have a balanced diet and not just, today I'm going to eat my chocolates. If you've had your chocolate, have a carrot. In other words, can you have your mouth clean? Can we remove those sticky substances that stick in the grooves of the teeth to cause them to decay? Where you can, brush your teeth after every meal. If you can't, as I said in the beginning, brush after breakfast. But it's a must, wherever you are, to brush before you go to bed. You will maintain your mouth healthy.
Okay. Taking water is good for our health.
Yes, it is.
Is it also equally good to oral health?
Of course.
How?
Say, for instance, there are some people who might come, for one reason or the other, they are taking certain medications. And some of the medicines that we take, some of them can leave you with a dry mouth. However, when you have water, not gulping, but having sips of water throughout the day, it maintains your mouth moistened, improves on the cleansing, and hence improves on your oral health. Water is very important.
So water is life.
Yes.
Wow. Doctor, we're about to conclude this discussion, but when I asked about that, there's something you talked about, and that was poor snacking. And I think as with the public, snacking is snacking. We don't know what good snacking is and what bad snacking is. We only attribute this to the place where you go. So when you go to this particular cafe, then that is good snacking, irrespective of what is served there. And when I go to somewhere in place B, then that one is poor snacking because of the structure of the place and all that. So for us, this is attributed to the structure, the facility where you're getting your snack from. But maybe to differentiate for us the difference between poor snacking and good snacking.
Okay. As dentists, these are our thoughts. You have breakfast, or let me look at a baby, a 5-year-old or a 3-year-old. You've given them their early morning meal, and come an hour later, they have a packet of Gorillas. And maybe an hour later, they have a glass, let me say quencher. They are snacking. And then lunch comes, they have their main meal. Between breakfast and lunch, what are we eating? Are we eating more of refined sugars? Are we eating a diet that might be detrimental to our mouth, or we are eating a diet that is healthier to our mouth? Gorillas, biscuits, name it, where we have refined sugars, compared to an apple, a banana, those are two different things. So in other words, in terms of quality, what are you snacking on? Is it a fruit, or is it a refined sugar?
Doctor, give us your last thoughts on this topic as we wind up this discussion.
Friends, we've been talking about the role of oral health to general health. We started by saying oral health, we said you cannot have good general health with poor oral health. Oral health will affect your general health. And my encouragement to me and you, at the earliest possible time, go out for a checkup. The money you pay for consultation, you might look at it as much, but it will be of value to you. Because if we find issues in your mouth, we will take care of your mouth and you will appreciate. If you have a challenge, we can give you hints, but reach out. Dentists are human beings like you. They go through what you are going through. They are there to help you. Thank you.
Thank you so much, Doctor. And of course, we applaud Mengo Hospital for giving us this opportunity to work together. And of course, we appreciate you, Doctor, together with the entire family of Uganda Christian University and Mengo Hospital for this time. Thank you so much. And to your viewer, it's a pleasure now that we know that you started with us and we are living together. Thank you so much. What you've done is the best and the right choice for this evening. Erin Austin Mukalazi is my name. We've worked with an entire big team of ladies, and of course, we wish you a blessed night.
Thank you.